Hello, this is a virtual microscopy slide of an aorta with syphilitic aortitis. And let's orientate ourselves first. This is the intima of the aorta, which is the innermost layer. And then we have the tunica media, which is this bright pink layer that is composed of smooth muscle bundles and lots of elastic tissue as well. And then finally, we have the tunica adventitia. And this is the outermost layer in which the small vessels, vasa vasorum, that supply blood to the aorta itself are located. Let's have a quick look at the normal aorta first. And here is a page from the normal histology section of our online pathology resource, Pathweb. Here we can see the aorta. Here is again the tunica intima, which is the innermost layer, which is composed mostly of collagen and some elastin. And then the tunica media, which is this thick layer that is composed of smooth muscle and elastic fibers. And then we have the tunica adventitia and the vessels of the vasa vasorum. In syphilitic aortitis, there is inflammation of the vasa vasorum, and we can see at this low magnification view that there are these patches of blue, and these are areas of chronic inflammation that are around blood vessels of the vasa vasorum. Let's look here. For example, this is a blood vessel. So this is part of the vasa vasorum. And we can see that there are these lymphocytes around the blood vessels. And sometimes there are also plasma cells. This inflammation gives rise to obliterative endarteritis with intimal thickening and eventually obliteration of these small blood vessels. In this other area, we have some discernible plasma cells as well around the blood vessels. And we can see here this little cluster of plasma cells with the eccentric nuclei and the bluish cytoplasm. So we have lymphoplasmacytic infiltrates going around the blood vessels of the vasa vasorum. And this gives rise to ischemia and therefore destruction of the tunica media, smooth muscle, and elastic fibers. So, for example, if you look at this area, there is actually a break in the tunica media, and the tunica media itself appears to be very uneven in thickness. It is thinner here compared to here. And we can see that there is loss in this area of the bright pink smooth muscle cells, and this is replaced by collagen. And similarly, over here, there is actually loss of most of the smooth muscle and elastic fibers, and this is replaced by collagen or fibrous scar tissue. Because of this damage to the tunica media, the tunica intima becomes very uneven and wrinkled, and therefore this gives rise to a tree bark appearance of the intima of the aorta on gross examination. Let's learn a bit more about syphilitic aortitis. Syphilitic aortitis is part of tertiary syphilis, and this is due to infection by Treponema pallidum. It usually occurs many years after the initial infection, and as you saw, it gives rise to damage to the vasa vasorum and then ischemic damage to the tunica media, which eventually leads to fibrous replacement and then weakening of the aortic wall. This weakening can give rise to aneurysm formation and also this kind of tree bark appearance with a very irregular furrowed appearing tunica intima. There is a separate video describing the gross pathological features of syphilitic aortitis on our virtual pathology specimen. Microscopically, as we saw earlier, there are lymphoplasmacytic infiltrates around the small vessels in the vasa vasorum, and then there is destruction and loss of the tunica media and replacement by fibrous tissue, giving rise to this kind of wrinkling, irregular appearance of the tunica intima. These pictures, as well as the gross pathology video, can be found in our free online pathology resource, Pathweb. Registration is free and the link can be found in the video description. In summary, this is an example of syphilitic aortitis. We have the wall of the aorta here with these lymphoplasmacytic infiltrates around blood vessels in the tunica adventitia. These are the vasa vasorum, the blood vessels that actually supply the aortic wall itself. And as a result of obliterative endarteritis of these small vessels, the tunica media becomes atrophied with replacement by fibrous tissue, and this gives rise to an irregular appearance of the tunica intima, and the loss of tunica media also weakens the wall of the aorta, which predisposes it to aneurysm formation. Thank you.